Welcome to another episode of Plastic Surgery Uncensored. I am Monique Marvez. This is Dr. Roddy Raban, board certified plastic surgeon here in Beverly Hills. And Dr. Raban, when we were setting up the notes for this one, we didn't even know what to call it because it was all of these sort of odds and ends, bits and pieces, plastic surgery miscellany. So can I just fire off a list of things and you'll tell me if it's a thing, if it's a thing?
I think what the interesting part about this particular podcast episode is, most people, when they think of plastic surgery, they know the big ones, right?
The broad strokes.
Facelift, rhinoplasty, breast aug, tummy tuck, lipo. You know what I mean?
Yeah.
These are the things that we do, some of which I don't do at all because they're odd. Some of them I do, and they seem like, oh, you can do that. And it's interesting, even though these are considered smaller surgeries and sometimes not, the impact is actually sometimes really big. And so I'll kind of touch on these procedures, again, some of which I do and some of which I don't. But I think it's really important to know that these exist sort of at the edges.
When I was looking at the list, I was like, reshaping the belly button? That's a thing?
It is and it isn't. So belly buttons are, for most people, they don't even think twice about their belly button. It's like this hole in there that's got like, what is a belly button? A belly button is where your umbilical cord was attached to your mom. And so when you get born, they cut it, they tie it off, and then let it just scar down and it heals. And that's where you were connected to your mama. Okay, great. Who cares? Well, it's actually considered an aesthetic component. Like there are people with beautiful bellies in which they have attractive belly buttons, and there's people with ugly bellies with ugly belly buttons.
Well, isn't an innie better than an outie technically?
Technically, but we don't want to get into the sort of Democratic Republican.
Yeah,
kind
no,
of
I
debate.
don't want
There's
to
no,
be.
we're gonna. This is an all-encompassing dialogue, but there is something to be said for belly button aesthetics. What makes a belly button attractive? So you alluded to one. One of the things is a lot of people don't realize it, but they have hernias.
Oh.
So what makes it an innie and an outie? A lot of people have bulgy belly buttons. And they kind of push it in and it pops out, and they push it in and they pop out, and they can't figure out why it is. Many times it's after having...
the turkey's cooked.
Yeah. Many times it's after having had several kids.
Oh.
So you can have a umbilical hernia, which is making your belly button look weird. And so the treatment for that is a umbilical hernia repair, which I do, and you can see your general surgeon or you can see your plastic surgeon, but that's going to make your belly button that was once cute in an innie that turned into an outie back into an innie. So that's one thing.
Okay.
Some people get these funky hooding or excess skin above their belly button that happens after they've had a few kids, and they get this little bit of crepey skin. So it takes a round belly button and it makes it kind of squashed because there's skin hanging. And if it's really minimal, you can do like in a little ellipse and take out a little skin, and it's like a belly button lift. Like you're lifting it open so that it's round again rather than squashed and kind of sad looking.
Like the eyelid without the eyeball.
Correct.
Okay.
Very good analogy.
See, I pay attention.
You're paying attention. Sometimes people come in with they had their belly buttons pierced and it's got like some funky scarring. Those are not so easy to fix. But where it matters the most is when you go get a tummy tuck.
Oh.
Because when you get a tummy tuck, we're sort of reconstructing your belly button from scratch. And so what happens in a lot of people is they go in, they get their tummy tuck, the belly button that their doctor creates afterwards is hideous. It's just ugly. It's round, it's big, you can see the scars. And then you go and get this it's like getting this Ferrari and it's got like hubcaps. It's like, it kind of ruins the whole thing. And not a lot of people as surgeons pay a lot of attention to belly button aesthetics. And I think it's crucial. So I think that's the whole topic from A to Z of belly buttons.
We have covered the belly buttons. Knee lipo.
This is the deal with knee lipo. Some people are blessed and they have beautiful legs, and some people aren't. And one of the things about having sort of unattractive legs is that you have wide kneecaps or wide knees. For most people, it's yours to own. It just is what it is. You have it. That's it. You own
Elephant legs.
Just like you're tall or just like you're short or just like you have green or blue eyes or whatever. In small instances, it's due to some fat accumulation, and you can liposuction the knees, but be very careful. If you get your knees liposuctioned, you have to make sure it's done incredibly skillfully, very conservative, because in exchange to having fat knees, you're going to end up getting wrinkly skin around your knees because they go and get aggressive, and then the area gets deflated, and you got weird dents like where your knees are. And so you have this leg that's coming down, all of a sudden there's a dent near the knee. And what is that? That's like they went in and just got their knees liposuction. So I'm not a huge fan of that. I'm kind of like, if you have big knees, live like rock it and just own it. So I'm
that's
not a
what
big
leggings
knee.
are for.
Right.
Okay. dimpleplasty?
I don't do dimpleplasties. It's kind of this is a bit on the fringes. It's like some people want dimples. They want dimples.
Make a dimple?
They make a dimple in the cheeks or they make a dimple in the chin. But the goal is to create that divot look.
How do you do that?
You got to go in, you got to suture, you got to cut the skin, take the skin and connect it deep inside. It's tricky. It doesn't always work out very well. There are certain things that God made that are irreproducible. And dimples I think are one of them because it doesn't look really natural.
What is a dimple? I have dimples and a cleft chin. What is a dimple?
It's a location where your skin tethers, or the dermis that's right on the skin tethers down to the underlying muscle. So when your muscle fires, it pulls that skin preferentially and you get a little dent there. Nobody knows the purpose of it. It just is what it is. The point I'm making is
it's like a freckle. It's just
I'm not a big believer that you can recreate dimples in a natural way. So I would stay clear.
Okay. Eyebrow transplant.
I think this is really advanced. I think transplant in general, so let's have a topic on that. A lot of people either on their own volition erroneously or by a medical condition lose their eyebrows. So there was a period of time where plucking your eyebrows was the greatest thing ever. You go and pluck the hell out of them, then you pencil them in. And now we live in an era where thick eyebrows are super in. Nobody wants some little eyebrow that's been either penciled or tattooed in. So what do you do when you don't have eyebrows? You lose them a lot from medical conditions, chemo. Some people, they atrophy as you get old. But bottom line is, if you look at beauty, thicker eyebrows is generally more desired.
Eyebrows are good.
That's why you pencil them in.
Yeah.
So we have gotten so far advanced in hair transplant that it's ridiculous. We used to do these plugs, like 4 at a time, hair plugs.
Wow.
Now your surgeon can take individual hairs, follicular units, 1 at a time, take one hair out and stick one hair in.
Where do they take them from?
From your head. And they pluck them in and they can make eyebrows. They can make you beards.
So if like you had forever, you lived in East LA and you had like chola brows your whole life. And then one day you want like, not Brooke Shields, but like, hey.
Yeah, you can get brow transplant and it works incredibly well. And you can, now listen, that hair is going to grow like hair on your head. So you're going to have to trim it more often, but it can work. Surely better than having some penciled in eyebrows. So I think hair transplant in general, whether that's for a beard, an eyebrow, your head, we've really made progress. That one I'm a big fan of.
Oh, great. How about rib removal? Are you a fan of that?
Definitely not.
That sounds to people, it's a thing.
Listen, I almost want to tell you that it's urban legend, but it's not. There are cultures and there are people who take things to the extreme. And there are surgeons.
Movie stars have done it.
And there are surgeons who will facilitate that. I'll leave it at that. I mean, I guess you could take a rib out. It's not, I mean, when I do rhinoplasty, sometimes I take cartilage out of a rib. So it's not that it's unheard of. Would I ever have a patient come in and be like, hey, Dr. Brown, I want to take my 9th rib out because it makes me look skinnier? Would I do it? Never. But it is done.
Bone. Wouldn't it make your rest of your torso sag where that bone's not in there?
Who knows? It
doesn't sound like
it's a little funky for me, but I thought it was worth mentioning because I know it's out there.
Okay. Nipple surgery, reduction, and correction of inversion. So that's a lot of nipple activity.
So I think this is actually a very interesting area.
Okay.
So we talk about breasts all the time. Beautiful breasts, full breasts, breast cleavage, blah, blah, blah.
Breasts that climb on rocks.
Because
breasts, sissy breasts.
Because breasts are a beautiful an anatomic part. But again, if you have beautiful breasts and, for example, have very large projecting nipples.
It's a thing. I've seen those in the locker room.
For a lot of women, that's not desirable. Assume for a moment that you're not in the subset that thinks that's good or your spouse likes it.
Does that come from lactating?
It can come from breastfeeding or you can just be born that way. Okay. So you have breasts, you went and got a breast dog, a breast lift, whatever. You have beautiful breasts, and now you have, let's say, 2-inch
they really can
projecting
project out.
nipple. Now you want to wear a bathing suit. Now you want to wear a summer dress. You have these gorgeous breasts. You can't. You got to wear the little chiclets. You got to wear nipple covers. God forbid it's cold or you're stimulated. So there is a surgery called a nipple reduction, and there are different variations of it. I do a technique called the telescoping or sleeve technique.
That just sounds painful.
Well, anything around the nipple and or testicle will sound painful. And what you do, and it's really, really, it's actually amazing because what it is you you take some of the skin around the nipple and push the nipple back into itself. Why I think it's super great surgery is, number one, you don't lose sensation.
That's
So
important.
listen carefully. People assume if I reduce my nipples, sensation gone. That is not the case. Two, you can breastfeed because we're not affecting the plumbing of the nipple. It's all external.
So it's like when you blow a balloon and then you close it and you push it back into the. You know how you blow up a beach ball? You got to pull that little plastic thing out to blow it.
I get that's kind of like it. It's a telescope. Like a
Yeah,
telescope
okay.
goes into itself.
Right,
That's why
okay.
it's called a telescoping technique. And I am telling you, I have seen this small procedure change women's lives. Because think about it, for those of you who don't have this problem. Imagine everything you wear without a bra or a very thick bra, you couldn't wear because your nipples were 2 centimeters long. And
That's
it's
a
like,
lot.
and it's like, well, what do I do? I mean, it's just what it is. So nipple reduction is super, super powerful, very easy to do. You can even do it in the office under local.
Oh wow.
The corollary to that is inverted nipples. There are thousands of women, probably hundreds of thousands of women, whose nipples stay inverted and have this sort of depression in there. So now it's the exact opposite of having too long a nipple. You don't even have any nipple present. So when you're without your clothes on, you have these dark sort of inversions where your nipple would be. For those of you that don't know what that is, Google it. And you'll be like, uh-oh. So that is equally.
Now, can an inverted nipple be a symptom of disease?
It can be. If you're older and you have an inverted nipple, you got to make sure you don't have breast cancer
Right.
and discharge. And if your nipples were normal and they become inverted, that's a concern. But this is a condition that you're born with for most
Oh, okay.
instances.
So you
And
grow up and they never just pop out.
Right. And in some instances, half of those patients, their nipples only come out with cold or stimulation. And half
Come
of,
out at night.
and half of them never come out at all. And there is procedures, which is inverted nipple correction, where we make them come out and stay out so that you have normal looking
It
breasts.
just sounds funny. I'm sorry. I don't mean to be disrespectful.
No, you're not being disrespectful.
Okay,
It's just
no,
knowing-
it's just- it sounds
so
funny.
I think that's really important to know, because there's a lot of women that when they get to me, they're like, I just figured this out recently. I wish I knew earlier. I haven't been naked in front of my partner in forever. Okay? So I think that those two surgeries definitely worth knowing.
Very important. Now, the colored part of the nipple is called the areola, because sometimes people get confused, like the nippy part and the.
Yeah. Okay. So let's talk about the anatomy. So you have the nipple, which is the part that you use to breastfeed, the
Right.
actual portion that projects. And then you have the pigmented area that looks like a pepperoni, which is the areola.
Correct.
There is a procedure called an areola reduction. And some people are just born with, or as a result of breastfeeding, their areolas become huge. And if you look at a breast, that's, let's say, C cup, if half of the breast, the areola, is made up of areola, that generally doesn't look very youthful.
No.
And so there are ways for us to make the pigmented area smaller, which generally means it looks a little bit more attractive.
All right. So that is the thing. Like
Yes,
you can
areola reduction.
you can make the pepperoni smaller.
Right.
Okay.
Got it.
Earlobes. Now this is This is important.
Because it affects you. Like,
I stopped myself before I said it.
this one's important. Everybody else now was weird, but this is really pay attention.
Earlobe surgery, reduction, rejuvenation, and torn earlobe correction. Here's the thing. Like, what I don't like when I wear hoop earrings and my earlobes actually swing now. They used to hold steady, but
Your ears are getting old, girl.
it makes me so sad. I stopped wearing hoops. I only wear studs.
All right, so let me tell you
Talk
about
to me,
earlobes.
Dr.
Okay,
Raban.
so ears shouldn't surprise you. Ears age too. I'm sorry. And yes, they get bigger, and yes, they start to grow hair and all these kinds of things. But the earlobe, if you think about it, we spend a lot of time, women particularly, showing off our earlobes. I mean, for the love
yes.
of God, you could put a $10 million stud in one earlobe.
That's right.
So, what is it about earlobes? So different things can happen. The obvious is that I wore very heavy, large earrings all my life. The earring hole is expanded. It's gotten larger. Usually one more than the other. My son grabbed onto my hoop and pulled on it when I was younger. It tore, whatever. So earring holes can be fixed. Most patients complain that my earrings don't sit symmetrical anymore. One of them is lower than the other because the hole has gotten larger. So we can repair the hole. We can cut out the hole, close it, let it heal, and you can re-pierce it from new. So that's a really important thing to know. Whether it's torn completely or partially torn or it's gotten larger, there is a surgery that fixes the earring hole. Another thing is my my earlobes are deflated. As we get older, we get deflation. We get deflation
That's
of
me. They're not as plump as
our
they
lips
were.
deflate, our butts deflate, our breasts deflate. A part of aging is deflation. So what do
You can almost hear the hissing.
I know. I'm sitting in a room with like 6 women. They're all like, shut. So when things deflate, the treatment is enhancement. So you can actually put very easily some volume, aka filler, in the earlobes, and they plump them up and they make them more projecting and more stiff, and they look like they did perhaps when you were younger, which will then hold the earrings better. So that's the floppy thing that you're talking about.
Okay. So that's a thing.
Right. And the last element is just like everything else. In addition to getting deflated, sometimes you get excess. And so you can do an earlobe reduction. Some people's earlobes get larger and larger as they get older, whether that was from age or wearing heavy earrings. And we actually do an earlobe reduction, which is kind of like a wedge or a facelift of the earlobe, making it tucked in more. And we can actually, interesting enough, take earlobes. There's 2 types of earlobes. Mm-hmm. You have attached and detached. Attached means the earlobe goes straight into your face, and detached means it has got a little bit of a swoop to it.
Some
play. Both are nice, both are fine, but you can make a detached into an attached by taking out a wedge. So for any rate, bottom line is that you can do a lot with earlobes, and for women who stop wearing their expensive earrings, there's hope.
So just out of curiosity, what is the plumping of the earlobe run, ballpark?
Well, it's usually about a syringe of filler.
Uh-huh.
And syringe of filler usually ranges in a good place between $500 to $1,000 bucks.
All right.
And it should last you, I don't know, 8 months, 9 months, a year.
Just curious. A friend asked.
Just curious.
Yeah,
I have this friend.
Not a big deal. Okay, this one I'm very curious about, but don't need the jaw shaving, because there's some people that have huge mandibles. They just have big jaws, and I think that looks very masculine.
So let's back up a little bit. One of the things is jaw shape. So in general, you want a strong jaw.
Yeah.
Man and or woman. That's why we do chin augs. That's why I do chin implants, et cetera, et cetera. Believe it or not, there's the opposite. And there's a lot of women, particularly of certain cultures, Koreans are one of them, where their jaws are just actually too strong, or they want a more feminine, more heart-shaped jaw rather than a square jaw like an Angelina Jolie jaw. Prior to talking about shaving, let's talk about Botox and the masseter. So one of the things which we didn't talk about is masseters. Those are the muscles that allow you to chew. Sometimes in certain people get ginormous, to the size of like a golf ball. And what they do cosmetically is when you look at someone, they look a little pit bullish. Their jaw seems very wide at the back. Mm-hmm. So from a cosmetic standpoint, it makes them look masculine. Additionally, why does that happen? They're either chewing a lot of gum or they grind like crazy at night. So we treat those masseters with Botox, and it does 2 things. It softens the muscle so it's not as strong, which then alleviates a ton of headaches, because you have people with headaches as a result of grinding, and it also makes their face look a little svelte and a little more heart-shaped, and they like that. The second area of jaw shaping is this jaw shaving thing. Again, I don't do it. It's a bit extreme for me. It's done a lot in Korea and places like that. And basically you go in and you literally with a burr, you sand down.
Like with a
a burr.
Wow.
And when you say shave down, you sand down the areas of the jaw that are prominent, whether that be the chin or the angle or places that are sticking out. Again, I don't do it, but if you are in need of that, you can certainly find someone that does it.
Back to the masseter, because I hadn't heard of that. Would that also relieve the grinding itself? Not only
Significantly.
does it make you look better,
I have a ton of patients who come in. I'm looking at them for aesthetics, like facial beauty. They usually say, "Hey, doctor, I don't like the way I look. What do you suggest?" And in their analysis, I said, "Hey, by the way, do you know that your masseters are really big? They make you look masculine." They look in the mirror like, "Yeah." And I said, "Do you grind?" "Oh my God, do I grind? I have a mouth guard. I actually cracked my molar. And I say, "Do you have headaches?" "Oh my God, so much." And then when you inject the masseters, their grinding drops, their headaches go away, their neck pain improves, because grinding all night can really have some ramifications.
Sounds terrible.
Terrible.
Well, grinding all night because of your masseter.
Not the other kind of grinding?
Well, we're going to get there, because we have a whole section on sexual stuff, but let's do hand rejuvenation, which is an easy entry into the
You
sexual.
go from hand into sexual.
Yeah,
That's
yeah,
it. I guess that's a decent segue.
Yeah, easy.
So hand rejuvenation is an interesting thing because at the end of the day, this is one of those telltale signs. You go to your favorite country club, you're talking to all these people, and everyone looks like they're like 50, and then one of them reaches in their bag, and you're like, oh,
Monster glove.
that lady ain't no 50.
No.
She's 80 because she's got classic signs of aging.
Yeah.
What are those classic signs of hand aging? Number one are spots. Your hand gets a ton of sun. And so people don't realize the value of putting SPF on their hands. So now we're much smarter. We put SPF on our face. We don't want skin cancer. We don't want sunspots. We don't want wrinkles. We totally blow the hands and we don't care. But the problem is your hands will age and get crepey skin and get a bunch of sun damage, which, like your face, is aging you.
And there's loss of volume. I can see
Yeah.
my veins now.
And
I can
so
never
the
see my
second thing that
veins.
happens, so the hands, the aging portion of it, the skin, the wrinkles, that you need to resurface like your face. So you get lasers and eye peels and whatever.
Yeah.
The loss of volume, which is what? Literally, you look at the hand and you can see all the tendons and all the veins. So if you remember your grandmother, as when you would see her and you'd hold her hand, you could see everything under the thin skin. So what we do now is rejuvenate the hand by filling.
You can put filler in your
You
hands.
put filler in the top of your hand, not at the bottom where
Right,
it's
right.
functional.
No.
On the top, which then fills in the valleys and makes your hand look a lot less aged.
That's
Pretty cool.
all right. So we've talked about the hands, and I think this is almost a natural slide. When we come back after the break, we're going sexual parts. So stay tuned to Plastic Surgery Uncensored. Welcome back to Plastic Surgery Uncensored. Now we're going down south.
Let's talk about it.
Let's go.
You're the one who's going to be uncomfortable, not me.
All right.
Say clitoris.
Clitoris. Sexually based surgeries. Now, first I'm going to start with labial.
So we're going to start with the women first.
Yeah,
And then we'll get to the men.
Yeah. So let for the sake of just so I don't blush my face off, like people can rebind their books. You know, I mean,
So let's talk about all the things that are presently
All right.
possible for female genitalia.
Okay.
In terms of rejuvenation. So
Okay.
number one is
Now, how does it? Well, let's just start from scratch. How does it give you away? How does it age?
okay. So what happens to you? Whether it's from age alone, you get atrophy, change. Nothing in your body.
Atrophy?
Nothing stays the same forever.
I'm sorry, I'm like 16 when it comes to this
Yeah.
stuff.
So atrophy means that stuff is starting to not function as well as it did.
Okay.
You lose lubrication.
Okay.
You have intimacy for many more years, and there's wear and tear. If you gave birth, forget about it. All bets are off.
Yeah.
Because if you gave natural birth, that is, there's on average 5 to 10 pound child coming through your vaginal vault. So for
That
you
can't
to
be
think,
good.
for you to think, especially after 2 to 4 to some people 7 or 8, I mean, come on. So that's what causes it. And
right.
what does it cause? So there's surgery of the actual vaginal canal. And
Okay.
that is, it becomes stretched wide, which affects intimacy for you and your partner, because a lot of intimacy is connected to friction and
Sure.
fit.
Yeah.
And so when you have your vaginal vault is large, you nor your partner can really experience the intimacy.
No, you're driving a bus through the Grand Canyon.
You got it.
Okay,
yeah.
so how do you make the Grand Canyon fit the bus better?
You got to make the
Turn
bus
it into
bigger.
the Holland Tunnel.
No, you got to get a big bus. No, I'm just kidding. No, so what you need to do is there's things called vaginoplasties, whereby which they make the inner imaginary cylinder smaller.
Okay.
Number one, I don't do this. It's not in my wheelhouse. OBGYNs are embracing this. A lot of them are doing cosmetics of this area. You got to make sure that they're trained to do it. So they can do it vis-a-vis heat or lasers or energy related things. So there are things
Really?
so you heat up the inside of the vaginal vault. Like everything else, it creates tightening and scarring, and that tightens the vault. Again, not my area of expertise. You have to do your homework.
Okay.
Another is plicating or suturing the inside, and like you do, you make the inside like you do for a tummy tuck, and you tighten the muscles there. You tighten the inner muscle wall by putting stitches and bringing the muscle edges together. That's called a vaginoplasty or internal tightening, okay?
Okay.
So that's one area.
Those
Another
are
area,
the insides, but
the inside.
there's activity on the outsides now.
Right. So the outside is the labia.
Uh-huh.
So the labia majore are the outer lips.
Right.
And there's the labia minora on the inner lips.
Uh-huh.
A labioplasty refers to adjusting or treating those labia. The inner labia are the skin ones,
Right.
and many women are plagued with them being large or asymmetric or floppy or
Kind of blown out.
right.
Yeah.
So that causes, aside from
I
embarrassment,
didn't mean to say it like that.
Yeah.
Yeah. But you know what? I've seen that in the gym. Let's
yes,
put it that way.
That creates, aside from embarrassment, that creates redundancy during intimacy. So imagine that skin gets pulled in, tucked, and causes pain.
yeah.
And it also affects bathing suits and like underwear, and you want to wear undergarments and you have this excess skin there.
Yeah.
So of the things that we do, and I do these labioplasties,
Okay.
this inner labioplasty is incredibly effective and very powerful. And by removing the excess skin, the hygiene is improved, the intimacy is improved, and the self-confidence is improved.
I'm not being facetious. What part of the lady's body causes sort of those big camel toes?
That's the labia outside.
Okay.
So then what we move to is the outer labia. And the outer labia, if your labia is very large, I don't really know that there's a good way to make them smaller. But definitely as you age, you lose fat
Right.
in your outer labia. And during intimacy, you don't have as much cushion.
Okay.
And as well, it doesn't look as good. And you can volume replace your labia majore like you can volume replace the earlobes we talked about, either through microfat grafting or some filler. And it gives it some youth again and some plumpness.
Really?
Your lips are no different on your mouth as outside your vagina.
You can. Wow.
Okay.
Okay. Of
Did you
all
just
the
go,
segments,
did your brain just explode?
Like it's of all the time you and I have hung out, and I think we're on like show 25. The idea that you can pump up the jam down south is, whoo,
Right.
that one went, whoo, right off the edge of the runway.
Right. So that's that. And then there's the clitoral hood. What is the clitoral hood? That's the skin that overhangs your clitoris.
Okay.
And in some, like everything else we just talked about, it can get overly stretched and excess. And we all know that the clitoris is for many women, the majority of women, is the orgasmic
That's the party button.
It's the epicenter of orgasm.
Yeah.
And so sometimes the excess skin gets in the way of the friction that's necessary for you to orgasm. So you can take out some of that excess skin, exposing the hood exposing the clitoris a little more, which will then increase your contact, which then increases your intimacy.
Okay. I'm just going to move on from that.
No,
I'm
wait.
going to sound like a child.
Okay, we got one more.
All right.
More.
Now,
Oh, so I do that as well. And then the
you
last
do that? You
yeah,
actually
clitoral hood reduction is part of the labioplasty.
Now let me and I want to ask you this because we're straight up. When people pierce their Ford Taurus, because that's a thing where people pierce it,
Yeah.
and then they take it out. First of all, I've heard people say that they get it pierced because it enhances pleasure or whatever. Isn't that scarring a problem? Like, does anybody ever come to you because they have a botched Ford Taurus piercing?
Not really. I've had people come to me with.
It's hard for me to even say clitoris.
Yeah,
it's
say-
like a
say it.
thing.
Just say it again.
Clitoris. It's just
Okay, it's okay. It's
Okay.
an anatomical part.
I know.
like the glands of a penis.
no. I know.
Right?
I know.
Okay,
I know. It's
So
just a thing.
so piercing of the nipple has created more scarring issues than the clitoris.
Okay.
Generally speaking. So the last topic in the female
the
section
G-spot
is the
enhancement.
G-spot enhancement.
Okay,
So for the record, I don't do this. I don't know if it works
because it takes too long to find it.
I
you
don't.
know I've got to make the jokes.
Or you do it. I don't know if it works. I'm not an OBGYN. I'm just telling you what's out there. And I'm just usually the one here to give you caution.
Okay, so what does that even mean?
The idea is that there's this anatomical area inside your vagina.
But has that been proven?
I'm not a scientist to tell you. You're a woman. Talk to your girlfriends. It doesn't really matter if it's proven or not. What matters is, do you experience it? Who am I to tell you? Because the scientist said it's there. Like, if you don't have it, you don't have it. If you have it, you have it. The idea being is that
I'm not even sure.
there's a part on the there's a part on the you haven't met the right guy.
On the inside, I've heard where it's supposed to be, but
So on the inside of your vaginal vault,
yeah,
a little bit inside, there's
Yeah.
an area on the wall.
yeah, but
That-
it's on the front side. I've heard
That when you get contact there, whether that be digitally or from your partner's,
No, I'm with you. We could just
okay. So when that gets friction or contact, it helps stimulate you and get you to climax.
Okay.
So it's clitoris and G-spot. That's
Right.
what's said. So the idea is that if you increase that area by giving it volume, enhancing it, making it more mound-like, there's more likely that things are going to hit it and rub against it. That's the basic premise. Again, A, I don't do it. B, it's not my wheelhouse. I would defer to women all around the country to ask themselves.
I think this is one of those things where if I want people to write into the
All right,
podcast, I want to hear about
what
this.
people can say. But anyways, bottom line is the point of the show is to talk about things that are on the outer skirts.
Yeah.
And then, of course, the last topic. We're
Okay,
going to
we're going dude.
We're going segue to men.
Okay.
And I don't do this. This isn't as common. There are very few people that do it. It's usually like urologists meet plastic surgeon. It's male enhancement. So penile enhancement, which is a thing that's done. Often it's done for people with erectile dysfunction, diabetics, people who, there are two men that generally get it. Diabetics, people with erectile dysfunction, it's just not functioning. You can't get an erection. And the other is people who are just born with small penises. I mean, women are born with no breasts. I mean, zero. They go to breast augmentation. And there's men literally that are born with microphallus, like tiny penises.
I saw one once.
You did? Once.
No,
that was it. You only saw him once. You never saw him again.
No, I gotta be honest.
Like it was date one. I saw him once.
No, I'm not even gonna say his name, but it's.
Well, I hope not, because we'd have to edit that out.
Here's his big strapping Cuban guy, very good looking. He dropped.
Aren't they always?
No, it was shockingly small, like shockingly small.
Right. So those guys, like women, are going to seek enhancement. Now, I don't do the enhancement. It's a bit tricky. Why is it tricky? Female breasts are static. They're just ornaments. They hang there and they look beautiful. Male penises have to go from small to large. They have to expand and contract. It's a more dynamic organ. So the problem with penile enhancement is it's trickier than just making something bigger.
I heard, again, in Miami, there was a guy at Mount Sinai who I heard that what they do is like part of your penis is on the inside and they can like snip some wire so more comes on the outside.
So that's a ligament release. That just makes it like, but the problem with a ligament release is where you go and cut this ligament, it makes the penis fall down a little bit, so you lose some of it. At any rate, we're not going to get into the details of it because I'm not the expert.
But it does.
It does exist. You just have to be super careful because it's not the same as getting a breast enhancement.
Can you really make it look bigger?
I mean, if you have, put it this way, I think if you have the problem is not if you have erectile dysfunction, it's not functioning, or you have micro penis. The problem is when you have like a pretty reasonable sized penis and you're like, I want to be bigger. I think those people get screwed. I think they get loss of sensation. I think they get hematomas. I think they get infections. I don't think it works out very well.
I wouldn't risk it unless it was really, this guy that I saw should risk it.
Do you want to send him the podcast?
Yeah, I think
The second and last item is testicular enhancement.
I'm not surprised by this.
Making big balls, larger balls. And what they do is they go in and like an implant, these are solid implants, solid silicone. You go in and you open up the sac and you put this implant in there so that your balls, again, I don't do this. I'm not sure that I understand the full.
I know where someone could get one done cheap.
Okay.
This is a true thing.
All right, well, we won't advertise it.
No, I'm not talking about a plastic surgeon.
Miami's.
I did a show when I was on KFI. They have a thing called nudicles, where when dogs are neutered, you can have fake balls put on a dog. I think that's so, I love dogs. And I thought I called the guy. It was not a crank call. It was legit. And I said, how many people have bigger nudicles put on the dog than what the dog originally had? He said 100%. And I'm thinking, what kind of a psychopath gets a dog neutered and then puts big fake balls on it?
At the end of the day, if you're doing that, it's an esteem issue. And if you want your dog to be like the man dog at the park, you're going to give him the biggest balls he has. At any rate, bottom line is you can do the procedure. I don't know. You have to figure it out for yourself. But our goal today was to give you the sort of odds and ends and sort of the miscellaneous of plastic surgery. I think we did a pretty good job. I think people are going to be informed. And,
maybe amused.
Anyway.
Freudian slip.
Okay. Nevertheless, tune into another one of our podcast episodes. Please, please, please share with your friends. Download, write us comments, tell us what else you want to talk about.
I've never asked directly. This is a direct ask. I want to hear about this G-spot situation.
Write to Monique, ask her about the G-spot. Don't send photos, please. And tune into another episode of Plastic Surgery Uncensored.
Yay.